I request the Prime Minister to start whenever they're ready.
Hi, just to make sure, can you clearly hear me?
Yes, you're audible.
Okay, great. I'm just gonna go prepare my timer real fast. Healthcare workers are in a unique predicament where we're stuck in the middle and they have lots of different situations going on. And at the end of my speech, I'll think that you'll find that it's really morally legitimate for them to opt out of treating patients during pandemic. Before I start giving you my substantives, let's characterize what a pandemic is and what it looks like. We think there's 3 unique aspects to pandemic. Firstly, it's that it's easily transmissible between person to person. Look at COVID-19, look at the SARS epidemic or / pandemic. It's easily transmissible to person, and we think that it's basically, it can also go through PPE, it can go through person protective stuff, and that's what it looks like, right? Secondly, we think it hits the vulnerable harder, like the elderly, like the immunocompromised, like children as well, and we think that's another unique part of a pandemic. And lastly, we think it's worldwide, right? So it affects everyone around the globe. So moving on to my substantives. Firstly, we think that even if you do opt out, there's enough manpower anyways. Let's characterize this. 2 layers. Firstly, we think that regular doctors would most likely put themselves through hell just to treat patients. Why is this, right? Because when you become a doctor, you basically we think that you're more incentivized to help patients, whatever patients you can, because of the fact that you took into that field of study, right? You wanted to help people, and that's basically who we are. For example, doctors who work all-nighters, that's without a pandemic already. Those are the people we're looking at. People who have a huge who dedicate themselves to patients, people who dedicated their lives to treating the illnesses of people, and that's who that's the majority, the huge majority of doctors that are out there. We think, and second layer to this is that in the pandemic we are in now, and even past pandemics, there's basically been no lack of any medical staff at all, right? Sure, there might be lack of PPEs, lack of ventilators, lack of vaccines, but it's never lack of medical personnel and lack of medical staff that is available, right? Look at COVID-19, where there's basically a surplus of medical staff that's working. Sure, they're working overtime, but that's basically them putting themselves to it. And we think that's what the world looks like. It's a world in which most doctors would help patients, most doctors where it's not understaffed, and that's the world we live in. What's the impact of this? The impact of this is that even if other healthcare workers opt out of treating patients during a pandemic, which is what the status quo is as well, there is enough healthcare workers to help fight the pandemic. And we think that because of this, it's not morally inconsiderate and it is morally, at the end of the day, morally legitimate. It's one reason why it's morally legitimate for healthcare workers to opt out of treating patients. Second thing I'm going to tell you is what doctors would opt out with treating patients during pandemic. We think this looks like A, the vulnerable, B, the scared, and C, the non-specialized. I'm going to proving to you why all 3 are morally justified to opt out. Firstly, about the vulnerable. We think that these vulnerable look like the old, the elderly, the immunocompromised, and also parents, right? Who have this risk to spread to other vulnerable populations. The characterization of this is that firstly, we think that because of the fact that a pandemic is so easily transmissible and is so widespread around the world and hit the vulnerable so badly, we think that because of this, they always have the chance of getting the pandemic, the flu themselves, right? Because of this, we think that they have a valid reason to opt out because it compromises their own safety and other people around them. I'll take you later, right? We think that they should have their own freedom to prioritize their own lives over any oath they took, because we think that at the end of the day, your own life should be prioritized over anybody else's. Yes.
Okay, in what world are the elderly and children healthcare professionals or healthcare workers?
That's why I didn't mention children in my analysis of what you told of the vulnerable, right? If the elderly are still going to be like, when I talk about the elderly, I'm also not talking about the 80-year-olds who are in a health care facility, right? I'm talking about like 60-year-olds, 50-year-olds who are still who can still be compromised from the pandemic, like we see in the status quo, like we see from COVID-19, right? That's what the statistics show, and that's what I'm trying to prove in today's speech. So the second layer is that when they are affected, even if they do demand on working on on treating patients, we think that even when they do get affected, which is easier for them since they are the most vulnerable, they're going to harm the patients who they are treating. Why is this? When you're sick, you're not going to be providing the best care possible, which is what the Hippocratic Oath specifically states for. When you're sick, you can't care for others in the same way that you usually are able to, meaning that you're not able to provide the same care if you are sick, if you are vulnerable. And that's another reason why it's also morally justified to opt out, because you're not providing your best treatment when you're vulnerable. You're not providing your best treatment when you're at your worst. So that's why the vulnerable is morally justified. Second category is the scared medical personnel. We think what this looks like on the surface is that it may seem morally legitimate, like they're scared for their own lives, and they want to opt out. But as I said before, when they are scared, we think that when they are scared, you basically doubt yourself. There's a whole layer of doubt that goes down to the very operation you're doing, and that's a huge part, right? If you doubt yourself for just a single moment, anything in the operation might go wrong. You might accidentally cut the wrong vein. You might do the wrong thing that might risk the treatment of your patient, might risk the treatment of the whole operation of COVID, right? Of the pandemic you're trying to treat. So we think that because of this, when you do doubt yourself, it's perfectly legitimate, because of the fact that if you don't opt out, you're putting your patients at risk. You're putting the people, whoever you're trying to treat, on risk. You're putting the people who are already lying in the ER on their beds, almost unconscious. You're putting them at the risk of dying and going to the grave, right? That's why it's also legitimate, because you have to provide the best care as you can. Lastly, we think another category of medical personnel is the non-specialized. We think that, why is this, right? In a pandemic, we think that there's hospitals are still going to call on a lot of different medical personnel to help, because they're going to want as many doctors as possible. Note that this is not a contradiction to the enough manpower point, because of the fact that when you fight a pandemic, you want everyone on board, right? No matter how overstaffed you are, you want everyone to try to help so that you curb the effects of the pandemic. So when you have the non-specialized trying to go in for, say, an eye doctor, they're not going to be able to, if they don't feel confident in their abilities to actually be in the front line and help the ones directly impacted by a pandemic, let them, right? Because if they're not confident in their ability, like the people who are scared, then they're not able to do their job the best, meaning they're not able to provide the best care to their patients. So at the end of the day, what side government stands for is a side where we're able to give the best care to people, and a side where we're still able to have enough manpower to treat the patients and curb the pandemic. That's why I'm so proud to propose. Thank you.
I thank the Prime Minister very much. Before moving on, please be conscious about your time. Leader of Opposition, whenever you're ready.
Hi, am I audible?
Yes.
I will start my speech in 3, 2, 1. We think, on-site opposition, that proposition utterly undermines the severity of the pandemic and how serious its impact is on all the existing stakeholders, on normal citizens on the ground, on sick people who need treatment, and on the medical workers themselves. But before this, some rebuttals. First, it's not likely that healthcare workers government asserts that doctors are not healthcare workers. This is a really weird thing to assert. By virtue of working in the healthcare industry, doctors are healthcare workers, so I will not understand why they want to defend the fact where doctors cannot take any time off. Doctors have to work their full shift without being able to opt out, because this is contradictory to their case. That is what opposition is supposed to defend. Okay, next. They talk about the three characteristics of a pandemic without giving much characterization. But first, the only problem we have with this is the first one. They say that COVID or pandemic diseases are easily transmissible. This is true, but this does not mean that it easily goes through PPE. Because if it did, why are hospitals around the world and every single medical worker around the world want to or actively use PPE every day when they treat patients? It wouldn't make sense if PPE was completely useless, and yet all these medical organizations want to spend money on it. Okay, next rebuttal. They say that even if they opt out, there will be enough manpower. Here's why not. In status quo, we already see hospitals being overloaded because apart from having to contend with future patients, they also have to treat COVID patients as well. Even more on that is that they have to provide extra services that are only exclusive during a pandemic. In status quo, this is like COVID testing or inoculation for COVID patients, which because it is on such a large scale that they need as many people as they get. No doctor can be able to do all of these tasks at once. So what government doesn't want to acknowledge is the current status quo, and this is why they at that point does not stand at all. Next rebuttal, final rebuttal, they talk about how healthcare workers who get sick will not be able to treat people anymore. Therefore, it is useless to be able, if we should let them take time off so they don't get sick in the first place. But the problem here is healthcare workers don't instantly become sick. They don't treat the COVID patient and suddenly, at the end of the day, they suddenly get COVID. Sicknesses or symptoms of COVID develop in people after a prolonged period of time. Even if we were to assume that PPE is useless, it does not mean that a healthcare professional will become sick immediately, and they will of course have already done enough to serve patients before they succumb to illnesses and are unable to treat. So on to principles. Our first principle here
Here,
is
why?
on how we protect the individual healthcare will know later. On consent. Government likes to talk about how all doctors already consented by joining the healthcare industry. Doctors signed the Hippocratic oath. Therefore, they have to serve their full time. This is exactly the line of argumentation that's supposed to be run on opposition. We say by virtue of these things, a healthcare worker consents to putting their life in risk for the betterment of others. By virtue of consenting, if you back out, if a healthcare worker backs out, it means they don't fulfill their moral imperative and burden that they took on when they become a healthcare worker. At the point in time when healthcare workers opt out, they knowingly refuse to treat COVID patients who are in need of treatment. This is morally egregious because you are refusing service to the most vulnerable stakeholders in today's debate. Second principle, society at large. On opposition, we like to talk about
Before you move on,
as what I've talked about, as what I've said about in the rebuttals just now. It's always better to sacrifice, no, not yet, it's not even 6 yet. It would be better to sacrifice one life to save 10 of them. For example, if a healthcare worker who is in charge of conducting COVID tests manages to test a few hundred or a few thousand people before being diagnosed with COVID themselves, even if that was likely, this would still mean that this causes the people who have taken a test to be able to know their diagnosis of COVID and for them to take protective measures if needed, like checking into a hospital to prevent it from transmitting to family and friends, or having self-quarantine to keep the safety of those people around them.
Here, why?
So by simply serving, they are already saving, hundreds and millions of lives more than their own. So we say on side opposition, it is more morally sound to save more lives than to save less lives, like what government would like to tell you. It doesn't make sense at all. Third, on urgency, we want to tell you why all of these principles matter in today's debate, but I'll take you now.
If PPE is as effective as you say, then why do doctors in the status quo and medical personnel need to quarantine 14 days still and self-isolate before they see anybody around them?
So by that same logic, are you saying that when someone gets inoculated for COVID, they can just walk out in public without using masks and not care about their own sanitary needs at all? That is your same line of logic. We, people in the status quo, take as many safety precautions as they can to maintain the health of every single person, especially themselves. So what you said didn't make sense at all. Why do all these principles matter? At a point in time in status quo, where hospitals are already filled to the brim, like I've characterized just now, if there are not enough healthcare workers, as we say they aren't, it leads to patients don't get treated in time. They die in hospital in the worst case, and in the best case, they suffer for a long time without necessary treatment, which causes them to rack out queue and stay in hospital for a longer time than necessary. B, there will be long waiting queues. Because hospitals are full, people will need to wait for necessary services like inoculation, like COVID checkups, or even getting treated for COVID itself, because there's not enough space inside the hospital. This means that when all these things are postponed, the virus is given more time to transmit and spread. When people are unaware that they are carriers of COVID-19, it's more likely that this virus will continue spreading among the populace, causing the pandemic to be prolonged. See, this is a self-fulfilling cycle, like I've just said. But now more people contract the disease on government side, and the hospitals are now under more strain and public pressure than whatever they had. So this is completely morally unjustified for healthcare workers to want to give up their own responsibilities and welcome this whole and open up this whole can of worms that just make society a horrible place to live in a global pandemic. And not just that, right? What happens now is that when the pandemic is worsened, this doesn't just cause the health of the country to become bad. This causes stakeholders like people on the ground to be unable to work, to be unable to gain livelihood because of things like lockdowns and security measures. This causes the economics of a country to crumble. So if government wants to come out and defend all they have said, they have to tell us why this is in the best interest of the people, and this doesn't just make the lives of every single stakeholder we care about to suffer. Because of this reason, we're very
I thank the Leader of Opposition very much for this speech. Now requesting the Deputy Prime Minister to start whenever they're ready.
Hi, am I audible?
Yes.
Okay. My speech starts in 3, 2, 1. Panel, look at our opposition today. They first have many contradictions in their case and then built their entire case based on the fact that PPEs are 100% like immune to viruses, right? Today, I'll be taking down each of their argument with 5 rebuttals and then providing you with 2 pieces of the substantives and providing a comparative of why our world is better than theirs, right? First of all, they first tell you that because hospitals are overloaded, there are never enough manpower to essentially deal with these COVID patients, right? Well, then we tell you that already said in my first speaker. A lot of the time, these issues, for example, like India, it's a lack of ventilators, air oxygen tanks, and in general equipment that is not always produced as quickly in the snap of a finger in order for these people to get treated, right? And they also tell you in the POI that my first speaker have asked that since they said that PPE can stop viruses from passing through, then why are there still pandemic procedures in self-quarantine, right? Well, the fact that he just waves this around by saying that he did not say this and it doesn't make sense just does not make sense, right? Because in his response to saying that these viruses can does not pass through PPE as easily and essentially makes these doctors immune to this disease just contradicts the whole point. Because if so, wouldn't it just make the whole world a lot easier if we all wore PPEs? And so we think that point does not stand. And secondly, they also tell you that healthcare workers don't become instantly sick, right? They contract COVID-19 and it takes a while for them to get sick afterwards. Well, we think this just completely disrupts the entire morality of a person as a doctor, right? So you think it's okay for a patient or for a doctor to treat like 5 to 6 patients and then they're okay for like 2 days and then go home and then basically infect their families, their children, the old, infect their society, and in fact might even cause death to themselves, right? So we don't think that when you are fulfilling your moral duties as they have mentioned, that a part of your moral duty is that you don't harm other person in the process of you trying to treat a patient, right? We think this is completely contradictory. And lastly, our fifth piece of rebuttal is that they tell you that it's better that a doctor is able to save like more people than to get sick afterwards, right? So we just think this once again goes against like a doctor's essentially their oath when they first sign up to this job, right? Because it's kind of saying that you can just die afterwards serving people. So we don't understand why this essentially props their case up. And note that the only substantive that they have brought up in their case is that if you don't have enough healthcare workers, you'll have long queues and not enough doctors. And we think that, again, as mentioned earlier, we don't think this is a problem due to manpower, as there are often a lot of health workers out there already, except it's just the fact that, again, other reasons such as vaccinations, not enough equipment, and essentially just spaces for these hospitals to operate, right? So starting off with my first substantive, right? We would like to introduce you why that the effectiveness and integrity of a frontline team will be decreased and in fact undermined when you have these people who essentially are scared, vulnerable, or essentially will makes it a lot easier for them to operate if a team has this one doubting member who is okay for them to opt out, right? First of all, we think that problems with this is that they're less committed, they're less focused, they will deliver worse, and they'll make mistakes, right? We think it's same concept as an army, right? You can't have an army who are doubters, right? We don't think this will allow you to win a war over. We're dealing with people's lives where like one mistake can cause downturn in events, and we think every second matters here. So we don't think we can afford the loss of one doctor being slightly less confident or being less committed to their job, right? And normally when you have a patient, they follow through, no thank you, they follow through a tons of protocols and procedures quickly, because those people who are the patients, their oath is to treat them as well as they can, right? But we don't think this is the case when you yourself, if you're a weak or an immune, like a person with weak immunity trying to treat patients, would be doing these things without any confidence, right? So we think it's a lot more legitimately for these people to opt out for the overall better cause. As we said, the shortage of workers are already not the major issue here, right? And for example, another stakeholder who is not just the vulnerable, but also people who has families, right? For nurses who has families too, it's not just themselves. If you have kids, families, we don't think have spreading this disease as a chain onwards and onwards would do anything well, right? And now moving on to the morally justified point. We don't think it's morally justified to put these doctors to be pushed through something that is against their beliefs. As the opposition's prime minister essentially bases case on that, it's their moral role that they have like sworn into this job, right? But we just tell you that we think if you're forced to do a task that you don't do as well, it's also a violation of their moral oath, because you're not giving your patient the best care possible, right? And this is same as parallel to the first aid rule. If you're in danger, or if no thank you, if you're vulnerable and you're not in a position to help someone else, we think having two patients is worse than having one, right? Alone, by having so many diseases that are spreading throughout, we think it's our doctor's best interest for those people who are vulnerable to essentially think out for themselves and see if they're best suited for this case, right? And let's just remind our opposition again, we're not talking about those people who are especially trained like the ER nurses, or those people who are, say, like the epidemiologists who have expert in this field, but rather those doctors who are called in just to take care of patients, and those people who say are eye doctors or just general family doctors who are here to care for those patients. And we think it's their decision, and in fact their priority, to make sure that they do not let down their team, they do not undermine their service to patients, and that they preserve their own lives, right? And okay, lastly, on the comparative, we think that on our side of those house, we only have to defend two things. Why that there is not, there will not be less doctors for like these frontline teams, because as we have seen all over the world, we haven't had a shortage of medical staff, but rather a problem in like vaccination shortage, ventilation shortage, and air tank shortages. And even if we do have to say that the team will essentially become smaller, we think that is a way more efficient team than having 5 out of 10 people who are slacking off, while having only 5 people who are best at their job and essentially being 100% focused, right? We think without doubters, it is more efficient and essentially just provides a better service, as I have explained earlier, with these healthcare workers being at their peak state to serve their patients, right? Okay, so why not overall on our side, we provide you with a world that these healthcare workers and the patients both benefit, right? Because right now on their side of the world, essentially you're taking the trade-off that many doctors will die while you're not even sure that these patients can be 100% treated well, right? We just think that on our side, we preserve the lives of both sides of the victim and also the doctors. You preserve the lives of doctor, but at the same time giving the best service that can have the best chances of preserving the life of these patients, right? This is why I'm never prouder to propose. Thank you.
I thank the Deputy Prime Minister very much for their speech, and requesting the Deputy Leader of Opposition to start whenever they're ready.
Hi, can you hear me?
Yes.
Okay. So I'll be starting my speech in 3, 2, 1. So obviously in today's debate, side government has been ignoring all the analysis given by my leader of opposition and has been ignoring whatever he has said in his speech. So first of all, I'm going to start with 3 rebuttals towards side government. So first of all, side government has made the main issue of the debate today about the PPE. But first of all, we must understand that the PPE is literally an essential barrier to curb the virus in status quo. And secondly, the PPE is not it's not what is supposed to be debated today. And what is supposed to be debated today is whether healthcare workers should be continuing to serve the people and help these people who are infected by the virus or who may be susceptible to the virus, and compared to quality healthcare, like a government has been asserting all this while. So, secondly, the government team has mischaracterized the idea of healthcare workers, whereby they have specifically said in their speeches that healthcare workers consist of doctors, whereby from the first speaker, but we see that healthcare workers consist of not just doctors, not just specialized officials or even surgeons. Healthcare workers also consist of nurses, paramedics, people working in the lab to test whether the virus, whether a person has contracted the coronavirus or not. So therefore, they have mischaracterized it, and we must understand that healthcare workers are no, thank you. So we must understand that the real characterization of healthcare workers are people who work in the healthcare sector that will go to their jobs every single day before the pandemic and even during the pandemic, where they are supposed to help people and they're supposed to attend to people for any medical reasons or any medical needs that these people have. Another thing I'd like to talk about today, no, thank you. Another thing I'd like to talk about today is that the government said that if we get all these doctors to work and to go to work and not be able to pull themselves out from their jobs and while during this pandemic, they said that these doctors will be scared and not confident in doing the jobs. But no more POIs, thank you. But the thing is, we must understand that when you choose to become a healthcare worker, when you choose to go into the to learn about healthcare, and when you choose to progress your career in healthcare, you know that healthcare is a very challenging task, whereby you have to attend to patients' needs, maybe even doctors on call, whereby you get called in the middle of the night just to serve patients or just to provide treatments. And we see that government clearly did not take this into account and said and told us that doctors are weak and doctors are scared, whereby this is not true, because doctors have been always doing their job whenever they are needed. Now I'll be going on into my points. So first of all, like what I've told you in my rebuttal just now, these healthcare workers consented to protecting people and saving people's lives when they choose their career path in the healthcare industry. And the motion has said that the PPEs and the personal protective equipments are sufficient. Therefore, the safety of these healthcare workers' health, or the health of these healthcare workers, are to a certain extent they are protected because of the regulations in place, such as quarantine, and because of the presence of PPE for them. So therefore, these doctors are actually quite protected from the harms that their job scope faces. And the problem with what government is proposing in today's debate is that the problem is when you let these healthcare workers take do not work during this pandemic, what will happen is that it will lead towards a few things. Number one, it will send a message that the pandemic is not serious. How is this? It is because when these healthcare workers are able to skip their jobs or do not perform their jobs, they know that it is morally egregious, because you risk people going out and dying, and these people who are vulnerable to the virus will not be able to take precautionary steps, because when you let these healthcare workers opt out, that means that the healthcare system of the country, like what my leader of opposition said, the healthcare system of the country will crumble because of the fact that there are less people working, and there are less people actually helping for vaccine rollouts to treat people. And what happens after this? What happens after this is that this is a virus, and this is easily transmitted. If we do not stop the continuation of transmission, what will happen is that more people will be transmitted. And when more people are transmitted, the problem with that is that the country will suffer longer. Lockdowns. The country will suffer from more economic drops. And why do we say this is bad? So first of all, this is bad because why? the healthcare workers, whatever the healthcare workers are doing, affects everyone around them by because of why? Because of the fact that when the coronavirus becomes
POY, last
more,
chance.
no, thank you. When the coronavirus gets worse in the country, what will happen is that these healthcare workers who opt out in the first place will cannot opt out forever from their job, right? So it takes a longer time if it happens inside government. If it happens on the side government, what will happen is that these healthcare workers the government is proposing to opt out of their job cannot even will never be able to return to normal. And what we say is that this is something very bad, because why? We want to try to alleviate the virus and to alleviate the effects of the virus. And without these healthcare workers actually working and actually giving healthcare services to these patients, we will never reach the stage whereby we have successfully alleviated ourselves from our communities from the virus. And another thing I'd like to point out in today's debate is that why the difference between side government and side opposition. So first of all, side government is harping about quality healthcare, but the fact is that quality healthcare is mutually exclusive because of the fact that quality healthcare on the side government will not exist and will take longer for it to happen, because of the fact that quality healthcare depends on many other factors and not just the state of doctors. So with that, I end my speech.
I thank the opposition very much for their speech, requesting the government whip to start whenever they're ready.
Hi, can you hear me?
Yes, you're audible.
Okay. Time starts in 3, 2, 1. Let's clear up this muddy debate, because all we have seen is repetitive points, strategic flaws that we've all seen from the other side. But let's break it down further, right? I'm going to clear up in my speech and finally solidify why we take this debate by a long shot. Number one, we see only mediocre responses and rebuttals from their side. What are them? Things such as saying doctors are frontline, doctors are frontline and health care workers by assuming so. Number one, no, that's completely false. There is separations, right? People such as your local clinic doctor isn't handling the most severe patients. The frontline workers are the people handling the COVID patients who are most severe. That's the definition. And when you see that their setup involves misleading the audience, involves misunderstanding the definition of the point and the stakeholder of this whole debate, how can we even take their points as valid? Then we go into the facts of how they fail to justify the trade-off. What we see in the whole debate, and let's do their job for them, is that they want one life to save 10, quote unquote, what the speaker said. Yet they fail to realize their principle. The whole policy contradicts this. Ultimately, what you see the reality on their side is that your 5 lives or your surplus of healthcare workers is saving 5 and killing 5. One of them could be one of your own healthcare workers on the sidelines. Then you see their only strategy is basically trying to argue both sides, right? You can't say that the PV is 100% effective, which is also another assumption, by the way. But then you also frame the workers as cowards, which directly contradicts your whole case. And then you go into the fact that they have no substantive. The only points which are still defeat later on to their fullest extent is not enough. And like they say that more is better. But where's the analysis? How does the quantity value more than the quality in a pandemic, which all of my speakers have said, a battle of life and death, and they dare say that quantity and a surplus of workers is going to help the pandemic effectively, right? What we see is, number one, extremely unclear setup. We see lack of analysis, and ultimately we're left with many different questions. Why is forcing workers justified, other than the fact that you keep on saying more is better, right? We have seen nothing from this, and ultimately using the same logic, let's bring up another analogy, right? Since they care about helping patients so much before the doctor, say a pregnancy is life-threatening, would you force a Catholic doctor to perform the abortion? Then we go into the 2 clashes in the main debate, which they failed to identify. Number one, on the level of justifying the principle, they haven't even they failed to identify the principle. But let's do that for them and prove why is ours trump over theirs, right? Number one, the model. There's unclear model, not really clear setup. But let's still move on to what the justification is. The whole principle is ultimately saying that more workers and quantity is equal to better, right? Number one, you only send us drops points, but we can still win that clash by taking that case to the best. How is that so? What we've seen from all of our speakers, right? We allow the fact that we're not forcing all the workers to work. Why? Because there are people and some workers who should be able to eligible to be opt out. Why? People such as the older, people such as the people who have weak immune systems, and not just 80-year-olds like they try to assume this debate as, but in comparison of, let's say, a 30-year-old doctor to a 50-year-old doctor, the 50-year-old one is most likely going to have a weaker immune system. They're going to have a higher chance to transmit the virus. And in a time of pandemic, why would you risk a surplus of 50-year-old doctors to then harm the frontline workers, to then have the risk of transmitting the virus to other patients as well as their own friends as well, or own fellow peers? Ultimately, what you see is our case is justified morally because we allow those that can complete the job well or is at risk of infections to opt out, which not only one increases efficiency and effectiveness without risking the health of frontline workers, but it ultimately helps the pandemic and doesn't really drag out as much as they say. Finally, we go to the point of how ultimately, if you're forced to do a task you don't do well, it's also a violation to the oath that you give to give the best treatment possible, right? This debate is about the degree of harms. This debate is about the consequences, and they fail to acknowledge the reality that these things even exist. Then we go to a final piece of justification about the first aid rule, a common medical practice. If you're not protecting yourself and you're not the right mentally capable, things such as having a weak immune system, things such as being scared, it leads to many different consequences, and also means that if you're forced to give care, which is their side, and you're forced to still treat patients with that sort of weak mindset, that you're going to be irresponsible. Then you're going to lead to many mistakes, which my speakers have already said. All we've seen from their side is the only response is basically saying that more is better, and we finally defeated that point today. Then all they really bring up is number one, they only justify this with assumptions at second speaker. Things are just saying doctors aren't scarce. The frontline workers obviously are. They obviously care for themselves. They obviously care for the families. But what do we see in the status quo? We see that most of the people are swearing to their oath. Most of the younger frontline workers are sticking to their ground and they're performing a great job. That's what we see in the COVID-19 pandemic. But we also see we should give the opt-out version for some of the people who are some people who are not going to perform the job well, some of the people who are going to risk the people around them and the people they're going to affect, right? This is a pandemic and we cannot take it lightly. This is what opposition ultimately tries to bring up and tries to justify without much. Then we go to the final point, which side contains the pandemic best? They even fail to acknowledge this as a clash or ultimately any points to bring up in response to our points, but let's still do the job for them and see how we actually win. Ultimately, their cases, their world is framed like this to make it more clear. They're allowing negligence in hopes of more manpower. That's their ideal case. But in comparison, what we see in the reality is that there's going to have a weakened frontline with incapable workers, people who are scared, people who are hesitant, people who are going to waste more of those precious seconds, as my first and second speaker have said, which are valuable in the pandemic because more lives will be lost on their side. In the status quo, many doctors who aren't specialized, i.e. eye doctors, are caring for COVID patients, right? They're in the front line and they should have the ability to opt out because number one, it's not their specialty. Two, harms can happen more because they're not specialized, even if they have PPE, because it's not 100% effective. And three, they have concerns for their families, but they also should have the ability to opt out because they should be forced to do a job they can't perform as well in comparison to helping other aspects, right? Not only do they lose under the clash of justification and the principle, which is the main focus of the debate, but they also fail to realize that the debate is about the degree of harms. Then again, what is their response to this? Absolutely nothing. Then we see that the only point that they bring up is that our case can return to our case or our model won't allow the pandemic to recover, right? Won't allow the normal to happen again. Where's the analysis? How is that? And even if it's only assumption and we take that as assumption, let's make it valid. Then how does your case really help us? In fact, your case is going to end more lives, it's going to hurt more people, and it's going to force the pandemic to not even return to normal, but rather it's going to be it's going to be filled with more deaths than our case. Why do we see this? Because Op's whole case undermines the entire operation to fight the pandemic, and that is also another focus of the debate which they fail to realize. This is the impact. How do they harm this in three ways? Number one, the whole battle is dragged along because of afraid, weaker, older doctors are wasting precious seconds being hesitant, scared, and slacking off because they aren't specialized, because they have doubt and they fear for themselves in comparison and over the patient's health. So they're more selfish in that sense. And patients don't get good enough treatment because of the weaker doctors are forced to treat them, but it's even worse on a worse treatment, which means that more lives are lost. We believe that we should not force most of those who are scared, physically weaker, because they should be able to treat more efficiently and effectively. Because when we get rid of those bad apples, because when we get rid of the surplus, we still have the ability to have enough good healthcare for frontline workers, and they still have the ability because they have a better immune system. They won't spread it to their fellow frontline workers, and ultimately they're able to perform the job more efficiently and effectively. Because of all these reasons, because we take all the clashes, because we show on the substances why we actually take this debate, we should absolutely win. So for all these reasons, this is why the motion should absolutely stand.
I think the government whip for their speech, requesting the opposition whip to start whenever they're ready.
Hi. Just checking, am I audible?
Yes, Sir Robert.
Okay, thank you. Starting my speech in 3, 2, 1. Firstly, ladies and gentlemen, before I start off with the more important parts of my speech today, I would like to break this deadlock that has existed in this debate ever since the first speakers. Now, the clash of characterization. They say that healthcare has enough manpower. We say that this is false because most hospitals, as we realize in status quo, are understaffed. For example, countries like Malaysia, Indonesia, India simply do not have enough healthcare workers. On government bench, they cherry pick what parts of status quo that is helpful to their case into their characterization, which is completely unfair to this debate and not correct in this debate. Their characterization was not analyzed or backed up in any way, and they must concede to our characterization because they failed to break this deadlock. My Prime Minister has already mentioned to you over and over again how hospitals have a lot more work to do in pandemics than usual, but there's no increase in staff, no rebuttal to that as well. Moving on, if your problem is overburdened workers, this policy lets COVID spread untreated and without vaccination. This leads to even more overburdened workers over a longer period of time, thus worsening the situation. You have got less doctors available, but more patients untreated in your world. Moving on, even if there is no shortage on government bench, having less people still gives the opportunity that they have to make sacrifices. For example, more and more patients come in as COVID gets worse, then they will have to choose who to treat first. And those who don't, they're going to suffer more. And is that ideal? I don't think so. Moving on, the idea that the other side has is that this process is cyclical. Now, talk about this, letting healthcare workers opt out, right? Okay, notice how this will put more strain on those who don't. It makes the situation harder to control, and thus even more people will opt out until nobody works anymore. And by that time, what will happen? The pandemic will become worse. Realize that. Moving on, talk about how on our side, we have no arguments. Now, let me just point out the three main arguments coming from our side. Firstly, the individual worker concern. Secondly, the numbers game of the majority. And thirdly, the urgency and severity of the pandemic, which is a snowball effect. I hope you understand that. Moving on, Prime Minister, what did Prime Minister bring to today's debate? Firstly, talk about how we are putting these healthcare workers at risk of dying. Firstly, realize also that we're not putting them at any risk. This is where the op comes in, as you mentioned. They already know their job. Secondly, they are scared. Hello, they are one of the bravest people that they are to exist, and they will not be scared because this is their job. Thirdly, risk for the patients. I don't understand how on how this actually stands, because obviously on our side we wouldn't do anything like that. My Prime Minister has already clarified to you that they can opt out for proper reasons. For example, they get sick. Moving on, non-specialized. Talk about being non-specialized. Okay, non-specialized. They talk about eye doctors. I don't know where they come from. No, thank you. Firstly, never have we ever mentioned eye doctors coming into this debate and how they cannot solve COVID. And secondly, also realize that the non-specialized here in this debate are the nurses, not eye doctors or anything of such. Moving on, the POI to my Prime Minister, talking about PPE. I find this POI extremely funny. Notice how this is a safety precaution, not on the efficiency of PPEs. Moving on, Deputy Prime Minister, what did the Deputy Prime Minister talk about to us today in today's debate? Firstly, talk about how we assume PPE is 100% effective. Firstly, we never asserted that it is, and secondly, it is in fact effective. No, thank you. Moving on, spreading to family. We simply cannot talk about this in this debate because it is already the moral principle that these healthcare workers will have to continue their job. Moving on, best case to patients. Okay, a best care to patients. Prove to us exactly how on your side you can provide the best care to your patients, because you simply cannot. We already talked about this to you several times. Moving on, no shortages of manpower. Okay, no rebuttal, no ops analysis to why this is true. Gov counter asserts even if there is no shortage of people on government side, having less people gives the opportunity that they have to make sacrifices. For example, I mentioned earlier, more and more patients come in as COVID gets worse, then they will have to choose.
Before you move on,
no, thank you. And those who don't, they are going to suffer. Please stop begging me. Moving on, many people who are afraid and worried to treat patients will make healthcare workers worse. The healthcare system worse, right? Okay, first response to this, doctors sign up for the job knowing full well in their years of medical training that they will encounter situations like this. Therefore, that is what they are prepared for. Moving on, even if they do panic, we still say having more people around, having some healthcare of not so good quality is better than on government bench where they have less people around and less healthcare in general. Moving on, the trade-off that we're willing to make today. The trade-off is something we are extremely aware of and completely okay with, because even if there's no ways to solve the problem with the pandemic, but we still can solve it better than you guys, because in your side it will only lead to more cases of COVID, and this is already proven. Moving on, government. Wait, let's talk about what the government will talk about. Talk about being cowards. We already characterized that healthcare workers are extremely brave. Moving on, cherry picking. They cannot say no, thank you. They cannot say all. They cannot say that only all doctors can opt out. If you have this debate here today, you also have to prove to me how you defend the 30-year-old ones who also want to quit. Moving on, more is better. Talk about more is better. In fact, more is better. We see that how extremely understaffed healthcare actually is in status quo. Moving on, how do you keep saying that they are not specialized when they are trained for stuff like this? This is their job. You are telling me just because I'm not on the national team, I shouldn't be debating, I should just leave because I don't have my whole profession built around debating. Now, moving on, the main clash of today's debate. clash of today's debate. Which side can better help stop the spread of the virus? Now, on government bench, what did they talk about? Government simply cannot stop the spread of virus better than us. They say, oh, staying at home, then the healthcare workers have low risk of getting the virus. Firstly, simply false, because the only thing that might happen is that PPEs exist and they probably won't get the virus as PPE does something, hence does not stand. Secondly, what the world looks like in Gov's world. Okay, let's talk about this. Their healthcare workers can opt out anytime they want for any reason. What does this mean? This means that they simply cannot protect national
Easy,
health.
babe.
No, thank you. On our side, what did we talk about to you today? Only on our side, we can stop the spread of the virus. Okay, we acknowledge it. We cannot solve it completely. That's completely impossible to debate in today's debate. But just because we're solving it better than SideGov, and we are simply winning this debate already. Only on our side, we can have the hospitals under control, while on OP, they simply cannot. Moving on, clash of healthcare workers. Let's talk about what Gov brought to today's debate. They say healthcare workers can opt out. Firstly, no, they already consented to it. Secondly, the safety of healthcare workers, again, does not matter. We already proven this to you. Third, risk for the patients. Explain on OP.
Last chance.
No. I will explain about this on upsides of the clash. Moving on, healthcare workers are scared, might die. Oh wow, simply notice how they simply won't, because there are proper measures taken. Motion already says that there's PPE, and notice how PPE is extremely effective. We're not completely done to go send healthcare workers to die. Now let's talk about opposition bench. Opposition bench talked to you about how, first of all, healthcare workers are brave and face deadlier transmissible diseases than COVID-19. For example, SARS, TB, Ebola, HIV, they are brave, and obviously COVID is not the scariest thing to them. They face why on earth would they then be scared of COVID-19? A knockoff target, more infectious version of SARS. Secondly, even if they are scared, they took an opt. They consented to everything that comes with being in the system, including death, injury, mental strain, being exhausted, blah, blah, blah. You get my point. Secondly, there are alternatives on our side. So we are still protecting the importance of the healthcare workers today. Realize that. Moving on, Gov's base case scenario. What is Gov's base case scenario to this debate? Gov cannot solve the problems of the virus better than our side. In fact, the situation with the pandemic cannot even be better at the very least. People will suffer from the virus. It is bad because death rates will continue increasing and the situation will last long. And on our side, we don't care about this. We can solve the problem better than that. Okay, notice that panel in a world where the sport of debate is centered by ad hominem attacks and putting words into the opponent's mouth, where teams win based on claiming their opponents have no analysis and are assumptions as a cheap cop-out to cover up their shallow arguments, where teams cherry-pick the status quo just like how religious extremists cherry-pick their takes to justify terrorism, we say team government has lost this debate from the very first speaker. I've never been prouder to oppose. Thank you.
I thank the opposition very much for their speech, requesting the off-reply speaker to start whenever they're. Off-reply speaker, are you there?
Yes, I am here. Am I audible?
I unfortunately can't hear you properly. Could you speak a bit louder?
Okay, is this fine now?
Yeah, this is better. Thanks.
All right, I will start in 3, 2, 1. Panel, in a world where the sport of debate is tainted by ad hominem attacks and putting words into the opponent's mouth that they have never said, where teams win based on claiming that their opponents have no analysis and assumptions as a cheap cop-out to cover up their shallow arguments with no rebuttals, where teams simply cherry-pick the status quo however they want for their own advantage, just like how religious extremists cherry-pick their holy texts to justify terrorism, we say team government has lost the debate from the very first speaker. 3 issues in this debate today. First, on the matter of unfair categorization. Government ignores the status quo. While it is true that hospitals around the world do lack inoculations and COVID testing equipment, to the same degree, they lack manpower as well, especially when there are so much more as usual as I've characterized, there was no response to that at all. Second, specialist doctors are not medical personnel somehow in government's world, and they already contradict themselves by saying in whip that they are. So I really don't understand how that applies. Third, government asserts that PPE is 100% useless in the first speaker. We already explained how PPE has a use. The simple line of argument repeated here is that if it's 100% useless, why would hospitals waste money on it? We never say that PPE is 100% effective. It's just that it plays an important role in healthcare services all around the world. And government doesn't want to accept that. So second, we win on the even if. We win on our worst case compared to their best case, which they never compare our best case to their worst case. Even if especially doctors were somehow not medical personnel, we still win because on their side, they have less people to care for the ever increasing number of patients during a pandemic. Second, even if hospitals somehow don't lack manpower on their side, we still win because of the same reasons of the ever increasing number of people in the pandemic, and in the end, the hospital is going to get overwhelmed. This looks like because doctors cannot multitask and do multiple things at once, we would rather have more workers that can perform 100% efficiency than less workers who has 100% efficiency but cannot focus on different things like treating a patient and making sure that their needs are taken care of, or giving out COVID tests or giving out inoculations. Third, even if PPE is useless, we still win because again, they never acknowledge the fact that illness doesn't happen instantly. Doctors don't one day suddenly fall ill and suddenly cannot work in the span of the first day when COVID patients are introduced to the hospital environment. That just does not happen, right? Doctors still contribute an important part of their effort towards lessening the impact of the pandemic before they even fall sick, if they even fall sick. So government doesn't want to acknowledge this at all. Third, concessions to every single one of our principles and how they're completely unchallenged. A, individual worker consent, which is something that government themselves uses in their own analysis, even though it's an opposition point, and we've already proved to you why this is exclusive to opposition and not government, simply because government squirrels their definitions. Second, the numbers game of the majority and how having healthcare is better than no healthcare. On government, they already concede to the fact that they have less healthcare people to take care of the ever increasing need of patients during a pandemic. So by virtue of that, there is no assurance to why, there's also no assurance to why on government, somehow the doctors who don't opt out won't get sick and won't somehow will perform even better than the doctors who could have stayed in but decided to opt out anyway. So this is something that was never mechanized on Gov. How are doctors healthier when there are less doctors? Third, the urgency and severity of the pandemic. On opposition, we are realistic. We acknowledge the needs of the people during a pandemic, on how it has severe economic consequences and how it impacts the most important stakeholders, the most vulnerable ones on the ground. On Gov, they don't care at all. They say they are perfectly fine with less people getting treated at once. They're perfectly fine with less people accepting service. If just maybe they could preserve a few extra lives of those medical professionals who have already devoted and consented to put their entire life and to put the lives of other people in front of them. So when government wants to be principally contradictory and wants to add prominent and put words into our mouth, this is why we say opposition.
I thank the off reply speaker very much for the speech, requesting the God reply speaker to start whenever they're ready.
Hi, sorry. Can you pause the debate for a while? I'm having some connection issues.
Yes, you're audible. Sure. Thank you so much. God reply speaker, whenever you're ready.
Hi, am I audible?
Yes.
Okay, my speech starts in 3, 2, 1. Panel, know that this debate is won by proposition for our merit of our arguments and not by opposition straw manning and attacking us and hence equating us to religious terrorists, right? So starting up in my reply speech, I'll be defining 12 main reasons why our opposition lose in today's debate, right? First of all, first argument, they first tell you that doctors have signed themselves up to this role and that they can't back up. Note that this is only characterized by the third speaker and fourth speaker in the reply only. And the principal justification was literally dropped at the end of the third speech. We don't think this should be properly credited as in terms of new material, right? And they also tell you that from like less doctors, meaning that they will work for longer hours and they don't save many people. Note this also only comes up in the third speaker speech, and we have not seen any sign of this in the first or second speaker. So this should also not be credited. So we see that the justification in the characterization and principle also failed in all basis, right? So third problem, they tell you that we're debating whether healthcare workers should keep on working to provide manpower or quality health, right? Therefore, on our side, we think that there are usually people who treat these COVID patients from the front line, and they're usually directly interacting with them. We like to remind them that these people that we're talking about, vulnerable people, are not the majority, right? You still have doctors who are strong and who are patient, who have patients who they're treating 24/7. So we think by their third speaker's characteristic on how these people who are like healthily trained, professionalized, these people are not the vulnerable that we're talking about. They're literally engaging on the terms that these people are the more stronger health frontline people, and they have not engaged on why these vulnerable people are essentially should be given a choice and why it's okay for them to opt out if they want to, right? Fourth problem, they tell you that first this debate is not about PPE in their second speaker, and then proceed to have the third and fourth speaker telling us why PPE is a solution to like these pandemic, and why that assuming that it's like accessible, that these things can somehow stop the viruses from proceeding anyways, right? Number one, we don't think this is something that you have brought up with explanation. But secondly, we also think that reasonably sufficient, as said in the as said in the motion, does not mean 100% working, right? We think just because you have a lot of access to these PPE does not mean it completely prevents all sorts of transmission, right? Fifthly, they say that doctors are strong and will do their job that they're requested to. If so characterized by their third speaker, we aren't telling every doctor to opt out, right? It's a choice that we should be given to vulnerables. Right now, they're debating on whether doctors should be helping patients or if they should not be helping, right? But our debate is essentially talking about whether they should be given this choice and why it's morally okay for them to opt out. So we think they have debated on the wrong stance of this motion at all, right? Okay, sixth problem. To tell you that who can stop COVID the best way, and that is opposition. Well, we tell you that when on your side you get more infected people because you have more people involved in dealing with this pandemic, right? Even though those people can be the vulnerable, the people who has no vaccines, or people who have weak immunity, well, on our side we get the workers who are in their peak condition, which makes them less likely to get infected, but also do their job properly and do their job the best, right? We think that they still don't have an completely understand it and engage in this up till the third speaker on why that this is the case, right? Okay, seventh problem. To tell you that countries will suffer from economic drops, right? Number one, as I've said earlier, vulnerable people are not a majority. And secondly, once you have opt out, your medical team does not just instantly vanish, right? Just because one doctor opts out does not mean that the entire program of healthcare worker just suddenly disappears. Eighth problem, to tell you that hospitals are overloaded and they never have enough manpower. Well, then they failed to accept the status quo, right? Because currently there are many doctors who are workers out there, but the thing is, it's just in the status quo, we have surplus amounts of healthcare workers. It's just those that who are put in the front line might not always be perfectly equipped or in their peak condition to do this. And finally, the last problem is we think that by comparing this to saying that if one doctor can just pass away while after treating 10 patients, this is just completely morally unjust, as they're saying that it's supposed to be morally good to heal these patients and treat them, while you're okay with a doctor dying after treating 1 to 2 patients without dealing anything about this. So this is why I've never been prouder to propose. Thank you.
I thank everyone for this amazing debate. Thank you so much, guys. It was very wonderful. Could all the panelists please text me privately about their calls?